Hi, Dr. John Torres here with NBC News on my daily doc, where twice a week I actually cover headlines. I get behind those headlines, get you some information, a better understanding of what that means and why it means what it means, to hopefully give you information you, your family, your loved ones, your community can use to get through this pandemic sooner rather than later and as healthily as possible. And then I answer viewers' questions. So if you have questions, please send them our way because they're all great questions. I love to answer them, and those are the things that you are concerned about. I want to make sure that we alleviate or at least answer some of those concerns. But let me start with the headlines first. And the first one I want to talk about are the reopenings that are happening across the country. Right now, in a few states, Texas, Mississippi, Iowa, they are looking to reopen things in their state. In Texas' example, what they said is next week they're going to rescind their mask mandates, and they're also going to rescind the mandates for occupancy levels. Up until now, it's been a percentage of total occupancy that can go in there. In other words, they needed to make sure they could social distance, they could do all those things. And they're doing what a lot of other states around the country are doing, is they're setting levels depending on number of cases in the community, possibly number of hospitalizations, possibly positivity rate. They're using different criteria, but the end point being, as the pandemic gets better, we open up a little bit more. As it gets worse, we start closing down a little bit more to try and keep those numbers low. Well, what Texas, Mississippi, and Iowa have decided is that they all are going to basically say, okay, we're done with that. We're going to rescind the mask mandate. We're going to go ahead and open things up 100%. As Governor Abbott said of Texas, 100%, every business in Texas has the ability to open up 100% starting, I believe it's early next week. Now, that's concerning a lot of public health experts, as you can well imagine, because the concern is, what's going to happen once they start doing that? Well, businesses have stepped in, and businesses are saying themselves, even though the governor's allowing that, we're not going to allow that. So hopefully that doesn't cause a lot of issues, because if we remember a few months back, particularly last summer, there were a lot of conflicts between people working in stores trying to get people coming into the stores to understand that they needed to wear masks, and the people coming into the stores not necessarily happy with that, and causing even assaults at certain levels. And so something you have to be very, very concerned with and very aware of. Now, here's a couple of main points I want to make. Is number one, is the CDC came out today and they said unequivocally that they don't agree with this. This is something that should not be done at this point. Instead, what they should do is they should have, again, those types of openings and closings that essentially yo-yo back and forth a little bit depending on what's happening in the community, because the community drives the reopenings, because if not, the reopenings are going to drive the community spread of coronavirus. And the concern is over the next 2 or 3 weeks after that opens up, we're going to start seeing higher and higher case numbers, and that is going to be a big concern that we might not get another wave of coronavirus. Part of the reason it's the concern is where we are right now, and I want to go over some of the numbers as one of the headlines as well. And right now, if you look at the numbers here, and I'm looking at yesterday's numbers, which are the latest we have, 67,000 people had coronavirus yesterday. If you look at that per 100,000 people, which I like to do because that's a baseline. Here in the country, 20.56 per 100,000, so a little over 20 per 100,000. Now, Texas, which is again rescinding those requirements, they were at 26 per 100,000. It's 26.47, so 26 per 100,000. So they're above the national average of cases right now. But regardless, again, looking at that 67,000 cases, the concern there is, okay, we're at 67,000 cases. That's certainly a lot better than the 300,000 cases we were just a few months ago. Looks great, but at the same time, you have to remember last summer, around June timeframe, we were at 20,000 cases and a few times got under 20,000 cases. And at that time, the current thinking was we needed to get 10,000 or lower than that in order to say, okay, we're starting to stabilize this pandemic across the country. We never got to that 10,000 number. We're not even close to that. We're not close to that 20,000 number right now. So that is a huge concern. The fact that we still have these numbers that are relatively high compared to where we want to be, and people are starting to open up. And what this does is basically shows us that, hey, we need to make sure that we do things nationwide, not necessarily community-wide, not necessarily statewide, to get this under control. And one of the reasons I'm bringing this up is because the CDC just released what they call their MMWR, which is essentially every week they release a report on different infections around the country. They've been doing this for decades, and they've certainly done it during the pandemic. And what they're saying in this MMWR is that when they looked at mask mandates and the opening of restaurants and outdoor dining, indoor and outdoor dining, they said allowing on-premise restaurant dining was associated with an increase in daily COVID-19 case growth 41 to 100 days after that was implemented, and it was a higher death rate from COVID, 61 to 100 days. So starting at 41 days, which is essentially a month and a half, and then going to start for the cases starting at 61 days, 2 months for the death rates. And we've always talked about how the death rates fall behind the cases because they lag behind based on when the case rates start. Usually it's cases, hospitalizations, and deaths. The concern is, looking at this MMWR and the studies they did, states that mandated masks did not have indoor dining or outdoor dining, or didn't have it at the full length that some of these states are looking at having it, they had higher cases and higher death rates from COVID. States, on the other hand, that had mask mandates and didn't have the robust outdoor-indoor dining had lower case rates of COVID and lower death rates as well. And so obviously the concern is, as some people said, this is turning into a living laboratory of what's going to happen in Texas. What are we going to see over the next month or so once they start opening things up? You have to remember, too, we're in the midst of spring break. College kids in particular have been at home. They've been homebound, and there's going to be that temptation to go to these different areas in Texas where they typically have a lot of gatherings for spring break, and that could certainly drive some of these as well. And I know there's a lot of skeptics out there that say, other areas have done it well. It hasn't been done on a statewide basis quite like this, and so, again, it's going to be one of these living laboratories that we hope turns out well, but the concern is it won't turn out quite to that level. So even though, and this is probably my bottom line for this one, even though your state might be saying you don't necessarily have to wear a mask and you don't have to worry about indoor dining or outdoor dining, you still need to wear a mask. You still need to worry about those things. And so if you're going out and about, please wear a mask, social distance. If you go to an establishment where it doesn't look like people are social distancing or they're not following those things that we know work to help prevent the spread of COVID, then just walk out and go to another restaurant, go to another establishment. There are plenty of them out there. Remember, I know we're more than a year into this pandemic. We're all very tired of it, but we still have a bit of a ways to go. We want to make sure that we don't take 2 steps back and end up back where we were a few months ago at these super high cases and then trying to figure out what to do with them at that point. So that's with both the reopenings and the numbers that we're seeing across the country. Now, the other one I want to talk about, the other headline I want to talk about, and you're seeing a lot of information, are the CDC has mentioned they are coming out with guidelines of what you can do after you've been vaccinated. That's been a huge question over the last month or so that a lot of people are asking. Okay, I've got my vaccines. I've gotten both of them. I'm 2 weeks after the second vaccine, and that 2 weeks is important because it takes 2 weeks for those vaccines to fully implement in your body to give you the most robust protection it can give you. And at that point, you're as protected as that vaccine can give you, the amount of protection there. So 2 weeks after vaccination, I've been vaccinated. What can I do now? Is there anything different? Do I still need to wear a mask? Do I still need a social distance? How about if I want to get together with neighbors and they've been vaccinated as well, or family members and they've been vaccinated? Well, the CDC has said we're coming out with guidelines, and we thought they'd come out with guidelines yesterday or today. They've delayed those guidelines a little bit, and the reason they've delayed those guidelines, I think, will turn out very well. One, they want to make sure that they're following the science, that they get these guidelines that basically ensure that according to what the studies are showing, that those are the recommendations they're giving. At the same time, they have been criticized in the past because they have given out guidelines that were too general or too scientific. In other words, they were hard to understand, or they didn't really apply to specific people. They applied to populations in general, and that can be a huge difference. And so this time what they want to do is they want to get it down to the household level. What can you do in your household if you've been fully vaccinated and everybody in your house has been fully vaccinated? Can you bring people in from other households who have been vaccinated? Can you have small meetings, get-togethers, small dinners, those types of things? They're going to come out with recommendations for that. And by all indications, they're probably going to say, yes, if other people have been fully vaccinated and you've been fully vaccinated and it's a small group environment, hopefully they dictate the number they're talking about, then you should be safe or as safe as possible because the risk is extremely low. On the other hand, if you go out and about in communities, especially if you go to a restaurant, if you go to dining in these states where they're opening them up, you need to be really careful, even if you've been vaccinated, because the big concern is we know the vaccine protects you from getting COVID. What we don't know, does the vaccine prevent you from transmitting the virus or catching the virus? So you can catch the virus and not have symptoms, not have COVID, just have coronavirus inside you, and you can spread it to other people. What we don't know is, does the vaccine protect you against that? Those studies are coming out. We're close to getting that information. And it looks like, looking at different areas, for example, Israel, nursing homes here in the United States that have high vaccination rates, it looks like it's cutting down on transmission. But we have to be sure. We have to make sure that is in fact happening. If so, that's going to be huge, great news, because that means that the more people get vaccinated, the more we're going to get this pandemic under control. But again, time will tell. In the meanwhile, again, wear a mask, social distance, wash your hands, small groups, all those things. And we'll see what the CDC guidance says. My guess is they're going to come out probably over the weekend. If so, when I talk about this on Monday on Facebook Live, I'll go ahead and talk about what exactly the message was there, what the guidelines are, and let you understand that. So now, briefly going over the headlines again. Reopenings in a few states. They're starting to fully reopen and rescind mask mandates. Public health experts are saying that's a mistake. It should not be done because it's just going to cause an increase in case numbers. Only time will obviously tell, but if you're in one of those states, please wear a mask, please social distance, and please don't think, go to these restaurants if you want to, but make sure that you're able to social distance at those restaurants, that people are wearing masks when they're not eating, all those things that we know work really well at keeping the pandemic under control. Number 67,000 a day, which sounds great, but we definitely want to get 10,000 or less a day. That has been the goal since the start of the pandemic, and that's something we really want to look at. So we still have a ways to go there. And then, of course, the CDC guidance and guidelines on what to do post-vaccination. Is it going to open things up a little bit? The best guess is here is they're doing some baby steps to open things up a little bit, and then slowly open them more and more as we get more information and more data. Like they said, they want to make sure the the guidelines are based on science, and then they're at the household level. There's something you can use. So hopefully by Monday, we have an understanding of what those are. But now let me see if you have any questions.
I would like to get the Johnson & Johnson shot. What are the side effects of that vaccine? Are they different than Pfizer and Moderna?
So they want to get the Johnson & Johnson shot, and the question is, what are the side effects? And actually, if you look at the studies, the side effects were essentially the same as Pfizer and Moderna, and most people complain of injection site arm soreness, muscle aches, fatigue, headaches, low-grade fevers, those types of things. With the Johnson & Johnson vaccine, the side effect profile was less than you see in these other ones. And the main ones people complain about: headache, fatigue, and muscle pain. Those are the three big ones. And people did complain about those on a fairly high level, but not nearly as high as some of the other vaccines. And I think part of the issue is because it's only a one-dose vaccine as opposed to two-dose. And we know with Pfizer and Moderna, that second dose gives you a more robust side effect profile. And so that can cause more issues for some people. So for the Johnson & Johnson vaccine, particularly if you're concerned about side effects, then you want to look at getting that because it's only one dose. But altogether, all three vaccines, and I said this many, many times yesterday, if you look at the numbers, Pfizer, Moderna, and Johnson & Johnson, those efficacy numbers, the effectiveness, they give a variety of different numbers, especially Johnson & Johnson, which drilled down a little more than Pfizer and Moderna. At the same time, the best number to look at is all three of these vaccines. After people in the human trials were vaccinated, they're fully vaccinated, meaning 2 weeks after the last vaccine, 2 for Pfizer and Moderna, 1 for Johnson & Johnson, nobody in the trial was hospitalized. Nobody in the trial died from COVID of those fully vaccinated. We're talking over 50,000 people. It doesn't get better than that. And like I tell people always, if you get the COVID vaccine, regardless of which one you get, and you end up getting COVID, which is still theoretically possible and it can happen, but you only have sniffles, you get through the sniffles in 3 days, and things are back to normal. You don't have long-term complications because of that vaccine. That's a win. That vaccine has done its job at protecting you. And we are seeing people with vaccines getting these breakthrough infections, but all these breakthrough infections are essentially people who say either I had no symptoms, I just got tested because I get it regularly at school, or my symptoms were so mild I didn't even really think twice about it. That is something the vaccine is very good at doing. So any of these vaccines you can get, and like I always say, the best vaccine you can get is the first vaccine you can get.
What about the children? When will they start getting vaccinated?
So what about the children? When will they start getting vaccinated? Well, the children 16 and above can get vaccinated right now. But looking at children younger than that, looking at some of these other vaccines as well, they are doing trials. Moderna is doing trials right now on 11 to 18-year-olds. Pfizer's looking at trials as well. Johnson & Johnson is ginning up trials. They're all looking at that. And then once they get through those trials, 11 to 17-year-olds, then they're going to start, 12 to 17-year-olds, then they're going to start doing the 5 to 11-year-olds, and then they'll do the 1 to 4-year-olds. What they do is they incrementally go down in ages because, as we always say in medical school, Children are not just small adults. They have different immune systems. They have different side effect profiles, and they're probably going to require just different dosing. So you can't just take the adult dose and say, let's give it to children. It should be fine. You have to go through those human trials to find out exactly what dose levels they need, how often they might need the shots, and what kind of side effects they're going to get from the shots to make sure they're safe and effective. And that's what they really want to do. And that's why with the human trials, they started with healthy young adults first. Then they expanded the adult pool to have older adults, those with pre-existing conditions, and those of different races and ethnicities to mimic what's going on in society. Once they got through the adults and they tested those and started getting them out to people, then they started looking at children and pregnant women. They're going to start continuing to do that and slowly work down. The hope is by this summer, 12 to 17-year-olds can get it before they have to go back to middle or high school. And then sometime in the fall, maybe early next year, elementary school students and younger can get it. And then at some point, this is probably going to turn into an infant vaccine, much like a lot of them. And that children will be getting them during their infancy like they do a lot of other vaccines. But it's happening. It's just happening as time goes on very safely and to judge both the safety and the effectiveness of the vaccine.
What if other people in your house aren't yet vaccinated and you are?
So, and that's a great question. And the guidelines might come out with some information about that. But the bottom line is if other people in your house are not vaccinated and you're fully vaccinated, what does that do? Well, if you've been living with them for a while, they've been under your roof, then the things you've normally done would not change anything different. And if you do have other people come over who've been fully vaccinated, and again, pending on the guidelines from the CDC, then you need to make sure that only the people that have been vaccinated are in this social gathering, that not the people that have not been vaccinated. Or if they are, that they're social distancing and wearing masks like we typically do. Of course, outside better than indoors, all those good things. But at the same time, you do have to differentiate between those that have been vaccinated and those that haven't, and realize that the vaccine, yes, if I get vaccinated, which I have been vaccinated, it protects me from getting COVID. What we don't know, does it protect me from spreading COVID to others, or not COVID necessarily, but coronavirus to others? We think it does, but we're not exactly sure yet at this point, and time and science will tell us fairly soon whether that's true or not. But in the meanwhile, again, the CDC is going to be coming out with their guidance, their guidelines. Hopefully they come out today or sometime over the weekend. If not, I'm guessing Monday, and hopefully for that Facebook Live, I can go over some of those guidelines and let you know what they're saying and what are the things that they're looking at doing. Again, one of the keys here is to do baby steps, is to open things up a little bit, because a lot of people are saying, hey, I got my vaccine, there's got to be more things I can do. CDC is answering that question, but at the same time, don't expect these robust openings, dropping of the mask, not worrying about social distancing. You're still going to need to do those things, but at the same time, there's going to be a few more things you can do, especially with friends and family who've also been vaccinated. But thank you for your questions. They've all been fantastic. Again, going over the headlines, reopenings are happening in certain states across the country, even though our case level is not down to the level where we think it should be in order to do these openings. And what a lot of health experts are saying is these openings should be done incrementally, baby steps through these openings, not just these robust, everything's open all at once, because that can cause a lot of issues. We'll know more over the next 2 to 4 weeks what issues it is actually causing. The best guess is that cases will go up, might go up dramatically. Hope not, knock on wood, but you never know. And hopefully they don't. And hopefully this doesn't turn into an experiment of sorts that backfires on everybody here in this country and we have more cases going. On top of that, looking at the case numbers, we're at that 60,000 level or a little bit higher. We definitely want to be at the 10,000 or below. And so we still need to do those things we need to do. And I talked about the CDC guidance for post-vaccination life, the things we can do. And things are starting to open up. More people are getting vaccinated. That's going to certainly help. But at the same time, we're still looking at low numbers, in the teens percentage of people that have been vaccinated across the country. We need more in the 70 to 85% of people in order to get that herd immunity and get this pandemic over. In the meanwhile, I hope this upcoming weekend is a great one for you. I hope you stay as happy and as healthy as possible. And hopefully this information gives you a little more information you can use to get through this pandemic. Not just you, but your family, your friends, your loved ones through this sooner rather than later. Thank you.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.